Hi friends, today let us discuss a very interesting remedy. Interesting in the sense it has lot of symptom in relation to throat and nose complaints. I am talking about Wyethia. Yes, Wyethia, Wyethia. I have seen in my clinical practice lot of symptoms of Wyethia which are so very important and so very differentiating feature, but because it is infrequently used or it has some symptom very common to other polycrest remedies, we have prescribed those remedies. The first symptom that you should remember of Vaithya is coryza from flowers. Now, this symptom is important, because we normally think about two remedies for this, that is either Sabadilla or Allium cepa. But whenever a patient comes and tells you that he's going in a garden, he's going in a by roadside, and there's a lot of flowers and a lot of this, and he starts getting this complaint of coryza and sneezing, you must think about Vaithya. Of course, Allium cepa is also there, Sabadilla is also there, but Vaithya is also there. Second symptom which comes to my mind is that dripping from the posterior nares. From the nose, it is dripping from the posterior nares. Like this, the patient does, and this symptom is so very common in Calibichrome and Phytoleuca or Alumina also. But because that Calibichrome and Phytoleuca is frequently used and studied, that's why we fail to appreciate this symptom of Vaithya, that is dropping from the posterior nares. And when this happens, there is salivation in mouth. And the salivation of mouth, the saliva of Vaithya has a very, very peculiar characteristics. First, the saliva is ropey. Yes, ropey. Now, we have a remedy which is so very common and frequently studied and prescribed, that is Calibichrome, where the discharge or ropey can be held in long strings. That is there, and Calibichrome, Phytoleuca and Sanicula is also there. But as Phytoleuca and Calibichrome, which are very close to Wyethia and these complaints, we normally prescribe one of these two remedies. The other thing of saliva is the saliva of Wyethia is thick saliva, and the patient will definitely come and tell you this symptom because it is a very, very peculiar symptom of that saliva, and the patient can understand the difference of thick saliva. Again, we compare this symptom with Calibichrome and Phytoleuca and see how close these three remedy goes. That's why the prescription sometimes differs from doctor to doctor. One symptom of Wyethia, which is very, very common and I've seen in lot many of patients, that is irritation. Irritation in public speakers and singers. So we have remedies like clergyman's sore throat, minister sore throat. In Wyethia, it is irritation of public speakers and singers, and this symptom will help you differentiate Wyethia with lots of other remedies. In throat complaint, one symptom is again very, very important, that is stitching pain in the right tonsils. Here, the patient says there is stitching pain in the right tonsil, and this is a very, very important and three marking symptom of Wyethia. Now, apart from this salivation and irritation, next symptom is dryness, and it has a very, very peculiar modality in dryness, that is dryness which is generally ameliorated on swallowing. When the patient swallows, the dryness is better. Very, very close to two remedies you must remember. The first for this is Cistuscan and second is Sanicula. As you go further, one symptom again much ahead than this, better by amelioration by swallowing, is the patient says that dryness is better by swallowing saliva. So the patient makes a lot of saliva and it takes inside and the patient feels better in the throat complaints. Again, compare this symptom with Cistuscan and of course Sanicula. So this symptom of dryness and symptom of salivation and symptom of throat irritation makes a very important and makes a very unique picture of Wyethia. One symptom that I have seen in many of patients of Wyethia is the symptom of mind, the irritability. The patient will come and tell you irritability from least exertion. He'll tell you, Doctor साहब थोड़ा भी मैं काम करता हूँ ना मेरे को बहुत चिड़चिड़ लगती है. This is the wordings of the Wyethia patient. Irritability from least exertion. So apart from the throat symptom and nose symptom, remember this symptom also. If you're asking throat symptom, do ask this symptom and the patient will immediately tell yes, and that is Wyethia. So my dear friends, these are some very important symptoms of Wyethia in relation to throat complaints which I have seen and clinically verified in my practice. So if you like this video, do share and subscribe. Thank you.